Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of public health and infectious diseases around the world and give you expert insights. And I do that on my weekly episode also of Inside Bird Flu with Dr. Jon Epstein, veterinarian, virologist, and disease ecologist who, like me, has spent his career tracking dangerous diseases around the world. Hi, John. Welcome this week.
Good morning, Jay. How are you?
Good. And so, we don't have a lot to talk about with bird flu this week, but one of the reasons we don't have a lot
that might be the problem.
Exactly.
Yeah.
It might be the problem. So there was a really nice news report from the Associated Press reporter this week noting that why haven't there been any bird flu cases, human bird flu cases, reported in the past 3 months? As you and I and everybody else around the world knows, something did change in the past few months, is that we have a new administration. And whenever we have zero public health reporting zero case reporting in public health, that is, nobody's reported a case of something, we always have to wonder, are there really zero cases or is there something else going on? So, John, what do you think? Do you think it's possible that there is a real decline in human cases of bird flu, maybe due to seasonality, control measures, or something else?
Well, I guess we'll start with what we do know, and that is that there is still circulation of bird flu in poultry flocks and on dairy farms, although some of that has been receding a little bit, which is good news. Some of these farms have fewer cases, and there is some monitoring going on there, but it is still circulating, and we are still seeing it in wild mammals. It's circulating there, and even in domestic cats, which we've talked about previously on the show. So it isn't gone. And people are still having contact. They're still working on farms. So you have to wonder, are there other cases occurring? And you would think that there should be. And it makes me wonder whether this is people, A, being reluctant to go to the doctor if they're sick and get tested, or B, a lack of effort. And these are not mutually exclusive, but there might also be a lack of effort in doing surveillance and trying to detect human cases.
Yeah. And this is just a perfect example of how public health is such a fascinating and interesting field, because it intersects so much with society and culture and politics as well. Who is it that's at the highest risk of getting bird flu? People who work on farms. Who are the most likely people to work on that farms? Well, they're immigrants, right? Some of whom may be in the country perfectly legally, and some of whom may be undocumented. And right now, with the massive effort by this current administration to basically scare immigrants away from coming into the country, scare those who are here into leaving the country or simply hiding, we have to wonder how much of this decline in case reporting is simply that people either aren't showing up for work, or more likely, they're simply working with their establishments to make sure that they essentially go fly under the radar. And if you get tested and positive for bird flu, somebody in government's going to know about it. And so it's probably better just to never get tested at all.
Yeah. And it's a sad reality. It's certainly not unique to the United States, though it's so unfortunate it's happening here, is that politics always does seep into public health efforts and surveillance efforts, because it is so hard sometimes to establish surveillance in certain communities, and particularly marginalized communities. So in this case, we're talking about immigrant communities who are under threat right now for being deported and are really concerned about anything that's going to draw attention to themselves. And so now there's an active disincentive, as you mentioned, for them to seek medical care and potentially be reported should they have bird flu.
Yeah, and this is an administration that doesn't engender trust. So just to be absolutely clear, we do not know. This could truly be a decline in human bird flu cases. But there are a number of things that make me worried about this that are related to this administration. First, we talked about the issue of immigrants and people not wanting to present to government attention. We've seen several cases of people being deported because they were called for what they thought was a friendly interview by a government agency, when in fact it was a trap. That's number one. Number two, this is an administration that in its previous iteration during the COVID epidemic, the president said, we need to stop testing because when you test, you find more cases and then you have to report more. So they already have a political bias against knowing how many cases there are out there. This is an administration that has actively tried to cut away resources for public health. So we know that there are fewer resources available at public health agencies to go out and collect samples and to record and report, particularly in public health labs. And finally, and most worrisome, this is an administration that has suppressed scientific information. CDC has stopped releasing health alerts on a frequent basis. It stopped having its clinical awareness calls. So there are a number of reasons for us to worry that zero reporting is not actually no cases, but rather it's not looking and not reporting even if you find.
Yeah, and I think it's important to talk a little bit about how surveillance happens. When we say this administration, it isn't necessarily just that President Trump is saying, don't go test for bird flu. But remember, the head of Health and Human Services, RFK Jr., is the one who makes decisions about funding allocations and what divisions remain intact or get reduced. And so under Health and Human Services comes CDC, which does a lot of surveillance, particularly influenza. They have a whole influenza branch, and they have lost a lot of experts and workforce. There's FDA that pays attention to influenza. And then on the agricultural side, the U.S. Department of Agriculture, that's not under Health and Human Services, but separately, it does surveillance in animals on farms. And so collectively, this generates a lot of the data we know. And let's not forget too, Jay, that in the states, state public health agencies do get some federal funding to operate. So there's state level budget and also federal budget, and that has been reduced too. So it is even harder to send public health officials out to investigate clusters of cases, and testing may not be as easily available. So there's a real trickle down effect when resources are cut at the federal level for some of the surveillance that has to happen in communities.
Yeah, and what worries me a lot is that there was another announcement this week that makes me suspicious about how much this administration wants to actually really identify and control bird flu. They announced that they are canceling a huge contract, over $600 million with Moderna, to develop an mRNA vaccine for human bird flu cases. And the reason so many of us like mRNA vaccines is because they are flexible platforms. So as this virus evolves, you can rapidly change the vaccine so that it remains safe, but it improves its effectiveness very quickly over time. And you can't do that with a lot of the traditional influenza platforms. And this announcement makes me really worried that if and when bird flu becomes a pandemic, we are going to be completely unprepared. And instead of Americans being the first ones to line up to get vaccinated, like happened during COVID, we might be watching while Europe and the rest of the world gets vaccinated and we have nothing.
Yeah. Now is certainly not the time to be pulling back on our efforts for surveillance. This is the kind of thing that ticks over in the background. And just because we stop talking about it doesn't mean that the virus isn't still evolving and circulating, and that its ability to infect people every time it does infect people improves. And so it's something we need to, in fact, increase our efforts right now to detect and understand viral evolution, because we don't want to get caught by surprise should there suddenly be a more transmissible form of bird flu that can effectively spread from person to person.
Exactly. And that is the reason that we have this show, is to keep you all updated on a weekly basis about what's going on in bird flu. And even if there are no human cases, we know that there's animals out there still being infected. We know this virus is evolving. We know it's not going away. So if you liked this episode, please actually hit the like button, hit subscribe. Please share it with anybody you know in your life. And we look forward to seeing you next week for another episode of Inside Bird Flu.
We'll see you next time.